Hand hygiene. Clean hands protect everyone. Many germs may be present on your hands, especially working in a healthcare setting. These germs can then be spread from patient to patient, from a dirty site to a clean site on a patient, and even to you. These germs could cause illnesses in both patients and healthcare workers. So protect yourself and also protect our patients from healthcare-acquired infections. The impact of healthcare-acquired infections is staggering. In the United States alone, 1 in 136 hospital patients become seriously ill as a result of acquiring an infection in the hospital. The costs of these infections range from $28 to $45 billion a year. And every day, approximately 247 people die in the United States as a result of a healthcare-acquired infection. This is equivalent to a 767 aircraft crashing every day, or more than 90,000 deaths annually. Infection control tracks the number of new healthcare-acquired infections. On average, there are about 25 HAIs per month. That's 25 children who did not have an infection on admission to our hospital, but acquired one during our care. Appropriate hand hygiene is the #1 way to prevent HAIs. It is an expected professional behavior for all healthcare providers, and it is required practice for standard precautions, sterile procedures, and our prevention standards. How is appropriate hand hygiene performed? On the infection control website under Hand Hygiene, Methods for Cleaning Hands, there are instructional posters from the World Health Organization on cleaning hands. The main points to remember are: include all surfaces of the hands and ensure 15 to 20 seconds of rubbing. Thorough hand cleaning is critical. These images mimic potential germs on your hands. The image on the left shows contamination on fingertips, which could be spread to healthcare workers, patients, or the environment. The image on the right shows frequently missed areas on hands after cleaning. Remember to clean all surfaces of your hands thoroughly. Which hand hygiene products should you use? The preferred product for healthcare workers is alcohol hand gel due to its superior bactericidal properties. However, there are certain situations where hand washing with soap and water is required instead. These include when hands are visibly dirty or soiled with blood or other body fluids. After any task which involves feces or the groin or rectal area. Always wash hands with soap and water before eating or drinking and after using the restroom. Also when caring for patients with certain types of infections, such as norovirus and Clostridium difficile. When are the appropriate moments for hand hygiene? The World Health Organization has developed a simplified model called Your 5 Moments for Hand Hygiene. This guideline may help you remember hand hygiene opportunities during patient care. Each healthcare discipline will have different scenarios and patient care duties that will fall under these general moments. Infection Control Policy IC-1.1 further outlines these moments. Before patient contact. This is important to prevent germ transmission from the healthcare worker's hands. These germs could be from the external hospital environment, including another patient, or from the healthcare worker's own normal population of bacteria. At CCHMC, we consider an inpatient's room an extension of the patient, so it is important to clean your hands upon entering the room before touching anything. This includes equipment and surfaces. In shared patient areas, this includes the immediate zone surrounding the individual patient. Before clean or aseptic procedures. This is important in order to prevent germ transmission through direct inoculation. This indication is determined by the occurrence of the last contact with any surface in the patient care area, including the patient and his or her surroundings. If gloves are to be worn, all preparation should be complete and hand hygiene performed immediately prior to donning gloves for the procedure. before preparation of patient medications, IV fluids, food, and formula. This is important in order to protect the patient from direct ingestion of germs. All supplies should be gathered and hand hygiene performed before preparation begins. After body fluid exposure, including contact with non-intact skin and mucous membranes. This is important in order to protect healthcare workers from patient germs and to prevent the spread of germs to the hospital environment. If gloves are worn, hand hygiene must be performed immediately after removal. After moving from a contaminated body site to a clean body site while providing patient care. This is important because hand hygiene will prevent the transfer of a patient's own germs to different body sites, such as from the groin area to the eyes. If gloves are worn, they should be removed, hand hygiene performed, and new gloves donned if indicated. After routine patient contact. This is important in order to prevent the healthcare worker from picking up the patient's germs and spreading them to the external hospital environment or to the healthcare worker's own skin or mucous membranes. If further tasks need to be completed in the patient's area, hand hygiene can be performed after all tasks are finished. After touching the patient's surroundings and upon exiting patient care area. It is important to remember that the surfaces and equipment surrounding the patient is contaminated with the patient's germs. You must perform hand hygiene after contact with the patient's environment, even if you do not touch the patient. This includes all occupied rooms, even if the patient is not currently present. After using any handheld electronic device during patient care, such as mobile phones, tablets, or pagers, it is important to remember that these items are contaminated with germs unless cleaned appropriately. We do not want to transfer these germs to the patient. If gloves are worn, they should be discarded, hand hygiene performed, and gloves donned again if indicated. Anytime hands are visibly soiled. Particulate matter on your hands can harbor germs and be dangerous to both the healthcare worker and to the patient. Soap and water is best due to the friction action required. Pay special attention to underneath the fingernails. This is why only clear or translucent nail polish is allowed. Remember these important points about gloves and hand hygiene. Gloves do not replace the need for hand hygiene. Gloves can represent a risk for pathogen transmission if used inappropriately. Gloves must be changed when hand hygiene is indicated. And gloves must not be washed, decontaminated, or reprocessed. This practice decreases the integrity of the gloves. There are only certain situations where this is allowed and involve special protocols. An important strategy in keeping our patients safe is partnering with our patients and families in the practice of hand hygiene. Share these 3 key points with our patients and families. 1. Germs are everywhere in our hospital. 2. Wash in, wash out. Make sure everyone, including staff, visitors, and families, have clean hands entering your patient care area, and leave germs in the room by cleaning hands before leaving. 3. Ask us. Don't hesitate to ask everyone if they have clean hands. When we share this message with our patients and families, we empower them to speak up if they do not see hand hygiene being performed. Here are a few points about hand hygiene etiquette. Cleaning your hands with alcohol hand gel or washing with soap and water as you enter a patient care area allows you to open the door and then clean your hands, thereby avoiding contamination of clean hands by the door handle. Allows our patients and families to observe hand hygiene. Show them that you have clean hands. Our hand hygiene monitors can observe your before patient contact behavior. And hand hygiene before PPE counts as before patient contact, but gloves should be changed prior to patient contact if contaminated surfaces are touched, for example, hallway door handles or clinic exam room surfaces. Here are a few ways to avoid touching contaminated doors in the hallway with your clean gloves. Use an elbow to open the door or pre-open the doors to facilitate entry. Finally, if someone asks you to clean your hands, comply promptly without questioning. We should all be concerned about the well-being and safety of everyone in our hospital, including all patients and staff. Remember, clean hands protect everyone.